This is the recording for Chapter 11, Genitourinary System. The urinary system consists of four major structures. We have two kidneys, which dump into the ureters, down into the bladder, and then urine is expelled out through the urethra and urinary meatus. The function of the urinary system is to monitor and regulate the extracellular fluids of the body. And in regulating this, when the fluids, we take in fluids, then whatever the body can't use, it is excreted out. So the medical term for urinating is voiding or micturition, and that is when urine is expelled through the urinary meatus. Pathological conditions that we see of the urinary system. Pyelonephritis is a condition where bacteria invades the renal pelvis and kidney tissue, often secondary to a bladder infection that ascended to the kidney. This is 8 times more common in women than in men, and the reason for that is the length of the urethra in men is longer than that of women. So when bacteria goes to the urethra, it has a shorter distance to climb to get to the bladder. So that's another reason why there's more bladder infections in women. If a patient has pyelonephritis, their urine will have bacteriuria, pyuria, which is pus in the urine, and hematuria, which is blood in the urine. They have symptoms of chills, fever, nausea, vomiting, and the telltale sign is that their urine looks tea-colored like iced tea, a brownish color. They will have a lot of pain in the flank area and the kidney area as well. Glomerulonephritis is any condition that causes the glomerular walls to become inflamed. It's commonly caused by strep throat or Streptococcus aureus. And the urine will have hematuria, which is blood in the urine, proteinuria, protein in the urine, and casts or protein solidification, which can be seen in the urine underneath the microscope. Nephrolithiasis is a fancy name for a kidney stone. So if you break the term down, iasis means presence or formation of, nephro means kidney, and lith means stone. So nephrolithiasis is formation of stones in the kidney which may travel into the ureters. When the stones begin to move, it becomes very, very painful for the patient, very excruciatingly painful when it gets into the ureter. It causes a pulsating pain called colic. Now, colic, usually you think of colic being with babies that cry a lot, but colicky pain is a pulsating pain. So you've all probably had that at some point. Maybe you were taking a hammer and putting a nail into a board and you slipped and thumped your thumb a good one. And so if your thumb is sitting there and it's pulsating and you feel your pulse in the thumb itself, that's colicky pain. So nephrolithiasis is the medical term for kidney stones. Hydronephrosis then results when a stone blocks the ureter. So let's say that a stone starts in the kidney and then it starts to pass, it comes down and it gets into the ureter, but it goes no further and it gets stuck. So if there's a stone obstructing it, the urine has nowhere to go, but it backflows up into the kidney, and then the kidney becomes dilated with urine. Lithotripsy is a term that can be broken down. Tripsy means crushing, and litho means stone. So if a patient has a nephrolithiasis that is too large in diameter to be able to pass through the ureters and into the bladder and out through the urethra, we do a procedure called lithotripsy. So it's used to crush the kidney stones that cannot be passed, that are too large in diameter. So here's a picture of a lithotripsy machine, and so they put the patient on this table, and then they have a shockwave generator that will send a shock into this ellipsoidal reflector. It reflects it through this water bag that the patient is lying on, and they pinpoint that shock wave exactly to where the stone is in the kidney, and they can determine where it's at by use of ultrasound. So they have ultrasound cameras, well, not cameras, but they have ultrasound machines that are pinpointing where the stone is at, and then they can use the shock wave generator to hit exactly where the stone is located. And what this does is it pulverizes the stone into a sandy gravel-like material that the patient will then urinate out. So this procedure saves patients from having a traditional incision into their kidney, so a big cut into their back to surgically remove the stone. So they can get back to work much quicker than a traditional surgery. Usually back to work in 3 to 5 days, whereas if they had to do surgery and actually cut into the flank area, a patient would be off work for 6 to 8 weeks typically. Urinary tract infection, abbreviated UTI. Most people have heard of urinary tract infection, and it is caused by bacterial growth in the urine. If a patient has a urinary tract infection, symptoms are burning with urination, frequency, meaning that they have to go at frequent intervals, hesitancy, in that when they start to feel like they need to go to urinate or micturate, they can't get the stream started, and they may see have hematuria or blood in the urine. So the frequency, the hesitancy, and the burning are the main symptoms that the patient would exhibit. Diseases and conditions in your book on page 361. The first one is anuria. Anuria, an means not or without, urea means urine. So this is absence of urine production or output. Dysuria, then, on page 362, if you break that term down, dys means bad, painful, or difficult, and urea means urine. So it's painful or difficult urination, commonly described as a burning sensation when urinating. The term hydronephrosis, we just talked about, and they show a picture of it on page 363, is abnormal dilation of the renal pelvis and the calyces of one or both kidneys due to pressure from accumulated urine that cannot flow past an obstruction in the urinary tract. Most of the time it's a stone, but it could be a blood clot or it could be something else. But you can see in the picture that the urine is just backflowing up into the kidney. Medical, surgical, and diagnostic procedures, page 364. The first term that you need to know is on the bottom. It's dialysis. You don't need to know the different types of dialysis. Just know that dialysis is a mechanical filtering process used to cleanse the blood of toxic substances when the kidneys don't function correctly. So we see patients on dialysis that are diabetic, that their kidneys have been destroyed due to high glucose circulating through their body. Culture and sensitivity. Let's see. Is at the bottom of 369. And this is a test that's used to determine what type of causative organism is the cause of an infection for a patient. Now, they show it in the urinary system, but culture and sensitivities are done on other substances other than just urine. Culture and sensitivities could be done on wounds, like when they take a culture of a wound, like with a Q-tip type swab. They do the same thing for a throat culture. They swab the back of the throat, and then they take the swab and then they streak it out on a auger, like what you would see. You might have seen them in microbiology or in high school if you ever did any culturing where you took a substance and put it on a plate and then put it in an incubator and waited to see if it had any bacterial growth. After they do the culture and they determine what the organism is, so the bacteria grows on the auger, then they can test the auger to see which type of antibiotic is going to effectively kill that bacteria, and they can send a report back to the physician to let them know what antibiotic will effectively eradicate the bacteria. The term urinalysis is on page 370. It's urine screening test that includes physical observation, chemical tests, and microscopic evaluation. So it's basically a three-part test, and so we can tell a lot from the urine based on whether there's blood in it, if there's white blood cells, if there's glucose in the urine, lots of different parameters that can be tested. Abbreviations to know, on page 372, C and S stands for culture and sensitivity, UA for urinalysis, and UTI for urinary tract infection. Spelling words for the quiz: lithotripsy, perennial, vasectomy, nocturia, spermicide, polyuria, and dialysis. You are responsible for memorizing the word elements and their meanings on pages 356 through 358. And that is again where you're going to make flashcards and memorize those word parts. Here ends the recording for Chapter 11, Urinary System.